Pediatric cardiac illness. Simply seeing a child, you cannot say you have cardiac illness. So most of the time, the children's heart disease, they're asymptomatic. And commonest heart disease in children is congenital heart disease, where you do not have any definite symptom. You do have a murmur at times, systolic and diastolic, cyanotic and acyanotic. They are divided into two groups. Commonest is the acyanotic heart disease. By far, the commonest is the ventricular septal defect (VSD). Next is ASD and PDA. And other causes of the acyanotic heart disease are pulmonary stenosis, aortic stenosis, coarctation of aorta, and so forth. And acyanotic heart disease, they are not common, but they have grave consequences, so they must be identified faster. They have cyanosis. Child has turned your cyanosed. He is bluish. He is not rather than he is in a normal pink color. So this is child who has a little bit fast breathing, who has cyanosis, who has cyanosis, who is not your pink. Who is sinus means your pink sinus means bluish mottled. So that should be dealt faster. TGA by far the grave one, and thereby it is to be diagnosed faster in the neonatal period and to be referred to appropriate cardiac surgeon. They need most of the time surgery. The second one may be in the tautology of Fallot's, common, but it presents a little bit late when the child grows little bit, a few years, few months after. Usually, child gets cyanosed, your has turned your bluish when he works because of the oxygen lack of oxygen desaturation. So these childs do not grow optimally. They have digital clubbing. They have your growth failure. They have polycythemia. They had recurrent episodes of heart failure and your pneumonia. Apart from this, how these childs present to your us. They have recurrent pneumonia manifested by fast breathing, tachypnea, whatever you call it, fever, cough, and crepitation in the lung base. At times, not always, inflamed throat. So this is how the pneumonia is diagnosed. They can present with the heart failure, like left ventricular failure is diagnosed by tachypnea, gallop, orthopnea, basal rales or crepitations, and their late stage rarely you can have cyanosis also. So if it lasts longer, if this left ventricular dysfunction or failure goes on unabating, untreated, then you have consequent right ventricular failure manifested by enlarged tender liver, raised JVP, and pedal edema. And of course, child is dystonic, more desperately sick child. They are to be admitted and then they are to be investigated, treated promptly. Otherwise, there will be some casualties. So without murmur, congenital heart disease is possible. They are not that common. Most of the time, they do have some murmur. So again, they are diagnosed by other symptom, as I said earlier, and and by a good hand expert echo, colored Doppler echo. Catheterization, cardiac catheterization is an answer to define or definite diagnosis of the cardiac illness, both the your cyanotic and acyanotic. And ECG, echo, they are an adjunct to understand the diagnosis. X-ray also, electrolyte changes may be also there. So cardiomyopathy is rare diagnosis but possible. Usually they do not have murmur, but at times they do also have murmur. Their diagnosis is echo-based, and exclusion of the congenital heart disease, structural defects exclusion, and their treatment is lifelong. How do you treat the infection or pneumonia is treated by standard fashion. The respiratory rate qualifying the non-severity, you have oral antibiotic. Respiratory rate qualifying severe pneumonia, you give IV antibiotic and admit maybe. And then your heart failure is treated with your diuretics, digitalis, oxygen proposition, and concomitant treatment of infections. At times, you need to use the inotropes, dopamine, dobutamine, and your epinephrine, norepinephrine, and so forth. So ultimately, treatment of the structural defects are to be closed by device and your open patch closure. So in good amount of times, you can wait until for the self resolution good amount of time they do so, but at times it is not the case. So go for the device closer or patch closer while you put in your catheter, or for your cardiac structure defect identification, is put this device in the same setting standard. The global people are doing it, and in this country it is happily is also been done. So once upon a time, cardiac ailment due to the hypothyroid disorder, hypo and hypothyroidism, very they were common. But nowadays the beriberi has almost extinct from this place, and even on the other developing nations also. So other metabolic disease, renal disease with hypertension, with cardiac involvement, they are also to be addressed. So creatinine and urinary and your ultrasound of the your KOB defines the chronic renal disease. Most of the time, you do have some answer along with the clinical examination of the patient.